Thank you so much. So this question is for Dr. Wilkins. Even before the pandemic, women of color, particularly Black women, faced significantly higher rates of maternal complications and deaths than white women. Experts are concerned that maternal health inequities will only worsen during this crisis due to the impact of COVID-19 on communities of color. So last month, I introduced the Perinatal Workforce Act, which would improve access to maternity care and grow and diversify the perinatal health workforce to better address some of the staggering maternal health inequities we face as a country. This bill is certainly a step in the right direction, but I'm worried about how the pandemic will only worsen this existing crisis. So, Dr. Wilkins, can you speak to two issues? One, the impact of the pandemic on maternal health disparities, and secondly, why it's important to prioritize the diversity of our healthcare workforce in responding to these crises and what we can do to mitigate the effects of the pandemic.
Mm-hmm. Thank you, Senator. I share your concern about worsening disparities, especially related to maternal health. We certainly are seeing issues related to follow-up care for patients across the board, but certainly individuals who are from racial and ethnic minority groups, especially Black women who are least likely at times to present for maternal care, prenatal care in a timely manner. So I share those concerns, and it's probably going to worsen due to some of the issues related to access to telehealth, the challenges with having children at home and providing, making sure that they are being educated remotely, the burdens that they're bearing, the loss of jobs. All of those things are actually increasing the amount of stress and burden on Black women. And so those are issues that are not related to actually healthcare delivery that are increasing their risks for maternal mortality and morbidity. As far as the workforce is concerned, we need more diversity, more people of color in the health professions, from physicians to nurses to doulas, and making sure that when women are with child and in this environment, that they don't feel the toxicity of the environment, that they feel welcome, that their pain is acknowledged, that their symptoms are considered, that they feel welcome and that they belong. And so we need to ensure not just that we increase the number of individuals who are in traditional medical roles, but in non-traditional ones like doulas and birthing experts, as well as individuals who are supporting mothers breastfeeding.
Thank you. In 2019, before the pandemic, Milwaukee County, Wisconsin declared racism a public health crisis. They were the first in the nation to do so, and since others have followed suit. Central to this declaration was a commitment to taking action, which we saw during our response to COVID-19. From the beginning, the city included race and ethnicity as factors in its COVID-19 data, and as a result, they were one of the first to recognize who was being most impacted by COVID-19, the city's Black community. Ms. Echohawk, how does the recognition of racism as a public health crisis improve our understanding and response to crises like the COVID-19 pandemic? And what can state and local governments do to improve their data collection efforts?
Yeah, these are absolutely such a great question. Thank you. These are absolutely integral things as we think about what it means to declare racism as a public health crisis. We recognize, and the research has shown us, that the impacts of racism impact the overall health outcomes of racial and ethnic minorities. And if we think about Milwaukee, I know that there are incredibly high rates of infant and maternal mortality in the urban Indian community in Milwaukee, who are served by the Urban Indian Health Program located there. And that is a direct result of not having access to transportation, access to safe, affordable housing, walkable spaces, all of the things that create the stress on a body that we know through the research is that racism actually impacts the stress in your body, and it impacts whether or not you can carry a baby full term. So it's in the recognition like that, you're able to take a holistic view of health and look at what is impacting your most vulnerable populations. And so in taking that into consideration, you're able to identify policies and procedures that can allow for ensuring you're getting the resources to the right people. However, you can't do that without the data. So if you're not collecting the race and ethnicity, what happens is these health disparities are effectively hidden, and you're not able to direct them to the right people to make the right impactful changes that are needed in order to improve the health outcomes. I would love to see every city across the nation declare racism a public health crisis, so we can begin to take that holistic look at health and recognize it's beyond just access to basic medical care. It's the holistic way that every one of us live, breathe, and where we pray and where we spend our time with our families, no matter where we are or what time of the day it is, it impacts our health overall.
Thank you. And I yield back, Madam Chair.